Welcome back, everybody. My name is Eric.
I'm Matt.
And we're here with Common Sense Conversations. Excited to be with you today. I am going to share with you one of my most embarrassing moments in my life. We were talking before, we always talk beforehand and some great discussions. And anyway, it caused me to remember this embarrassing moment that I had. So I went to China and taught English, right, for about 8 months. It was a great experience, one of the best of my life. And I mean, I could go on and on with stories I had over there in China, but
some he can't share.
Yes, some get, if the Chinese government were to find out about them, I'd be in trouble. So anyway, I'm on this plane heading back. But I shared before about how I hit my thumb with a hammer. There's something else that happened in China where I cut my hand open with an industrial-sized fan. That's a story for another day. Okay. Had to go get stitches in China at this little place. Anyway, fun experience. But anyway, so this one though, I'm on an airplane heading back to the United States. I'm done with teaching, right?
Yep.
And so obviously from China to the United States, this is a long flight.
Yes.
Big plane. There's, just to set it up a little bit, so there's three seats on each side and 4 seats in the middle. So this is a big plane, long, hundreds of people. And this is, we take off and it's late at night, right? And so the first thing everybody, they do is they turn off the lights and everybody goes to sleep, right? And so, I don't sleep very well on airplanes, moving vehicles. I have a hard time sleeping through things like that. But in this case, unfortunately, I did. I fell asleep. Unfortunately, I fell asleep, and I had this dream. And it was a weird dream.
Oh, no.
I have no idea why I dreamt this, but I dreamt that I was at this palace and meeting with the king, right? And it's a dream of a spiritual emphasis, because I'm a missionary in this dream, and I'm teaching, or I'm preaching to this king, and I'm basically telling him to repent, right? And repent and turn your life around and all these things. And he kept saying no, no, no. And we keep going through all this stuff. I'm trying to remember the details that, as dreams go, they fade over time. But eventually I'm getting kind of upset with him because he is not going to repent, right? And this kingdom's in turmoil. I had this sense that we had to get this king to turn his life around. Well, it gets to this point where I'm almost yelling at him, right? Because I'm getting worked up here, and I'm saying, repent, for he is mighty to save. And about halfway through that sentence, I wake up. And as I wake up, I realize a couple things. One is I realize that it was a dream, and second, I realize that I am yelling on this plane in the middle of the night. Everybody's trying to sleep, and I'm yelling. I'm not just talking. I am yelling out, for he is mighty to save, right? I don't know what I said before that, but I'm just yelling out. And that wasn't the worst part.
Oh my, really?
You would think that was the worst part.
Now he's getting red. Okay.
Yeah. Every time I think about it, I told you this is an embarrassing moment, right? Every time I think about this, but the worst part is I'm sitting in the middle seat, okay? I have my friend, he's in the window seat, right? Okay. Not a very good friend, he didn't let me have the window seat, but that's for another day. I know, right? You'd think. But I'm in the middle seat. The seat next to me is this Chinese guy. I have no idea if he speaks a lick of English. Didn't have a chance to talk to him at all. But I realized that when I woke up, my head had gone like this. I was yelling in this guy's ear, right? I mean, I was right next to his head. I wake up, look around. There's people that are like, what's going on back there? Yeah. Anyway, so how it relates, you're thinking, what on earth? Why is he sharing this story? And we were talking beforehand about all this stuff that's happening about these leaked emails. No, I guess they're not leaked; they were just released, right?
I think they were.
Of Biden's emails and about all these things that are happening, and
Fauci's emails.
Fauci's emails, and all these other things that are happening, and sometimes, like the message, "He is mighty to save," is a good message, and you want everybody to hear it, right? You wish that you could shout it and that people would listen, but things happen, experiences, timing, all these things happen that make it so that we feel suppressed, right? We're not able to share that message. when you're dreaming, you're not as suppressed, as you might otherwise be. But we have an important message, and just as important, not just as important as He is mighty to save, but it's an important message.
Sure.
And it's something that we want everybody to hear because of what's coming, because of where the government is and where it's heading, and we can't share it the way that we'd like to share it, as I did, right? We can't just go out and shake people and say, look at this, wake up.
They look at us like we're crazy.
Yeah, so anyway, that's how it ties in case you were wondering. That's one of my most embarrassing moments in life.
One of, not the?
I have some others.
Okay.
We'll save those for another day. For another day.
So we're talking about things that are going on in government, where government's going, right? And why it's important for us to share this information. We don't have anything specific. We didn't come to this today with a specific agenda that we're going to share this part of the concept or this part of the idea of becoming your own banker specifically to focus on this. But there's kind of this undertone for all of our conversations about maintaining and protecting as much freedom and liberty as we possibly can. And the more we see things happen within our government and in the world, the more concerned we are and interested in sharing that message of how a person can keep more of their money and keep it safe, right? And Dr. Fauci's released emails might not have any big bombshells, maybe nothing that some people on one extreme end of the spectrum with really strong feelings about him might have been looking for some serious bombshells saying some specific things, and maybe those aren't in there. But then folks on the other end of the spectrum who wholly support and believe everything that he has said, there's enough in those emails to maybe make some of them question whether or not they should have just taken everything he said without a grain of salt, right? There's some, what I like to call, there's some consistent inconsistencies through email threads. Inconsistencies within the emails, and then also based on timestamps, there's inconsistencies from between what he said out loud in public and what he was saying in emails as he corresponded with other people. And consistent inconsistencies. But one thing I think about is that this poor man may have been plucked out of the medical field, if you will, when he's ripe and ready to be put on a pedestal. And he was certainly used as the expert witness when it came to everything COVID related. And it'll be interesting to see whether or not he is supported because of those inconsistencies, or whether he is villainized, because of those inconsistencies, and whether or not he has as much support going forward. And I think,
or neither.
Yeah,
they just sweep it out of the rug.
Yeah, maybe he's protected to that extent, and then still held up as an expert who can say no wrong, which I think is how he's presented. Whether he likes it or not, I think that's one of the ways a lot of people see him. And that to me is concerning, because it just teaches me that the powers that be can take anybody who might not have asked for it, and they can put that person, that imperfect person, on a pedestal. I certainly wouldn't want to be put up on a pedestal. I have to be very careful of the things that I say regarding financial services or advice regarding finances and insurance and things of that nature because of my licensing. But even if I didn't have that, being put out there and having somebody record every word you say and then having all those words scrutinized, I wouldn't want that.
No, I don't think any of us would. And truthfully, I was thinking about this. Some of the things that he says, any reasonable, some of the emails that we were talking about this beforehand. This whole idea. You'd mentioned that he believes in masks. Everybody should wear a mask, but if he promotes it too much, they're going to hoard masks. And so, how do you promote wearing masks without getting people to hoard it? So he's got to tone it down and all these things. Well, that's a reasonable conversation, right? That people, you have that conversation in your head and with other people. That you don't think that that's really that damning, but when it's out in the public, obviously there's a whole new twist on, now it's, there to be scrutinized, and, they weren't, we as a public given the idea of groupthink, right? This whole concept of groupthink, we don't think the way an individual does.
Yep.
And so, I totally see how some things could have been like,
Yeah.
that's just how it is. But
And I think that we can learn a lot from this situation, as we have from other situations. We can learn a lot about the way that media, the government, or the think tank of information or misinformation, the way that they try to manipulate and control information in order to shape and manipulate or control that group think, right? So we go back to the way the situation was handled when it was discovered that emails were missing, had been deleted from Hillary Clinton's servers while she was Secretary of State, right? We go back and look at data that was found on computers talking about Hunter Biden's indiscretions and the way that situation was handled. And then we look at this situation and we can see that those powers that be will handle the information a certain way. And so it's just something to be aware of. I think it's something for all of us to watch for, be aware of, and try to see the instances where something is being manipulated or controlled, just so that we have a better idea of what's going on. There's always these accidental or these unintended consequences when the government does something. And we also were talking about that a little bit earlier.
yeah.
We'd mentioned the Cobra effect, right? Tell us a little bit about that.
The Cobra effect. So this is a really cool example of, I think, what's happening now in our economy. And there's multiple examples of this. Matt shared a couple of them with us, and before this conversation started. The Cobra effect started in Delhi, or is this big problem that they had in Delhi. And what happened is that they had all these cobra snakes that were going in homes and around the city, and obviously this is an animal, a reptile that is very dangerous, very venomous, and so they were having this big problem. They said, and so the government said, okay, we got to take care of this. We are going to pay everybody that brings in these snakes dead. We're going to pay them, so much money. And it worked at first. They had, the snake problem was going down. They were eliminating a lot of snakes. But over time, what they found is that even though the snakes in the city were decreasing, they were actually bringing more snakes in for that financial reward from the government than they had been before when the snake problem was really bad, right? Somehow they were bringing more. So the government couldn't figure this out. They were like, what's going on? They didn't know what was happening. And down the road, they found out that they ran into these snake hatcheries. And so the public said, hey, here's a great business, right? I'm going to start breeding these snakes. And now, not only do I not have to go out and catch them, they're right there. I have a lot of control. It's a whole lot less dangerous. I can kill them a lot easier, and I can breed them fast and then take in the money. And man, this is a great business opportunity. And so now not only were the snakes out in the city not being taken care of, but now they were exacerbating the problem. And that's not the worst part, is that later on, the government said, okay, well, now that we know that this is happening, we're not going to pay this financial reward anymore. And so those that were in charge of these snake hatcheries said, oh, well, if we're not going to be compensated anymore for these snakes, we don't need to have these snakes anymore. So they let them go. They just let them go in the city. And so the problem became a lot worse than it was before, right? And so go ahead and tell us, how is that relevant for today?
So many ways. This last week, I've got a friend who works as an ER nurse, and his story got me thinking about this. In some of the stimulus packages we've seen this last year, there's a lot of pork in those packages, right? A lot of things that don't necessarily have to do with COVID stimulus, and not to get into that too much, but part of the regulation that came out that I wasn't even aware of until he mentioned this to me. I was asking why he was working so many hours, and he's so tired, and it's been heck on him. Not because of the number of COVID related cases going into the ER, but he explains it to me this way. Regulation came down with the most recent stimulus package, I think, allowing more people, indigents and non-citizens and folks of low income and people who were receiving the stimulus, gave them access to health care that they didn't have before. What that meant was going to a doctor's office, they could go without an insurance card to a doctor's office and just pay a small copay. But if the doctor wasn't open, then they could go to the emergency room and it would be free up at the emergency room. Now, a couple of things to highlight here. First off, we've got to talk a little bit about the difference between the expenses at the doctor's office and the expense of an emergency room visit, okay? If a person with an earache goes to the doctor's office and pays a small copay, that doctor just takes a look at their ear, their nose, their throat maybe. It's regional and he focuses on an earache, right? Mm-hmm. When the person goes to and that doesn't cost very much, relatively speaking. When a person goes to the emergency room, it costs $300 to check into the emergency room. I wasn't aware of this. And then it costs $300 for a nurse to come in and evaluate a person in the room they're assigned. And then it costs $1,000 for a doctor to come in and visit with that person. Okay, we're getting expensive. Now, because of the expense of malpractice insurance for that doctor in the hospital, he has to charge a lot more than the doctor at a clinic. Okay, and in order to protect himself against lawsuits and whatnot, he's going to
check everything.
So he's doing a lot more scans. He's doing a head scan for an earache, right? Mm-hmm. And so when that person leaves the ER, they might have, let's say, a $3,000 bill that is completely free to that individual that the rest of us get to pay for, right? Mm-hmm. If they go down to the clinic, then you and I are paying, I don't know, a few $100s left over after that person paid the copay, okay? So that's worth noting. The regulation stated that if the doctor's office was closed, they could go to the ER and get free health care. So what they saw happen was an incredible increase in the number of cases of somebody walking into the ER with a sneeze, a sniff, a sniffle, a cough, something relatively minor. He told me about a young lady who came in for a simple pregnancy test, but she still has to go through the entire process. And so they're doing blood work to rule out other things as well and to protect themselves, in addition to giving her a pregnancy test that she could buy from any number of stores out there.
Including the dollar store.
Yeah.
As far as I know.
Yeah, you can. I don't know how effective, we're not promoting that necessarily, but anyway, our videographer mentioned that if you wait long enough, you'll have a test that'll prove whether or not a person's pregnant. So there's all kinds of less expensive options. Now, I'm not saying that a person shouldn't have access to health care, but when the government says, go here where it's 10 times as costly if this place is closed, what happens is a whole lot of people wait until 10 o'clock at night to go up to the ER, right? Mm-hmm. And so rather than fixing a problem, the unintended consequence might be that it's hospitals are overran with relatively minor cases. The ER, people forget that an ER stands for emergency room, right? Mm-hmm. And they go up for all kinds of different things when the doctor's not available. So that's one example that hits pretty close to home. This guy, at that point in time, he was absolutely exhausted. And they have a shortage in workers a little bit, but they've also got a shortage in rooms. That might be the more important consequence here. They try not to put multiple people in one room, but you have to have somebody there for observation for a certain amount of time, even if it is just an earache. So when somebody comes in with a real emergency, or for those of us who are sensitive to the COVID issue, if the person is actually facing a real respiratory emergency, they might have to share a room with somebody who's up there for a sneeze, a sniffle, or an earache, or a pregnancy test. Those people shouldn't be going to emergency rooms, but that's an unintended consequence of some of the legislation that's been passed. Mm-hmm. We see another example. Doug's got a friend in the hospitality business, working in hotels, and was laid off, as a lot of people were during that time. Not as many people are traveling and using hotels. We see a lot of people laid off who are restaurant workers during that time. Restaurants being closed down, and there's a shortage of employees now. And so Doug tells us I don't remember now how much the guy was making with unemployment. I don't remember, but he somehow was earning more.
He was making about $300 more, right?
With unemployment?
Yeah, with unemployment. So he's making $900 a week, and he's making $300 more on unemployment. Yeah.
So he goes to work and earns 6 a week, or he stays home and he earns 9 a week. Now he's the kind of guy who's not
nine or 12, I think is what it is.
9
so
or
he's
12?
making 9,
Okay.
and then he's making 12.
So luckily, he's the kind of guy who's going to go back to work, because there are people traveling who need hotel rooms. So we need hotel workers, and we don't need more people on the government teat, I think we call it around here, right?
Yeah.
You have to edit that out. So we don't need more people on the government dole who are capable of working, right? But because of the legislation that was passed to offer more money to the people who were unemployed once they qualified for that benefit, unemployment is no longer just some percentage of what you were earning. It's not as simple as 75% of what you were earning. Now it's 125% of what you were earning, or something like that, right?
Yeah.
And good laws. People need money, I get it. I wish we had a government that was fiscally sound enough to provide emergency funds when we're in dire straits. But the truth of it is we aren't. We don't have a government that is that solvent. And so that's got its own consequences. But my heavens, we have people in government saying, here, we're going to give you more money to stay home than what you would earn if you went back to the job that you had. And so restaurants are closing, hotels don't have enough people. Some people make the right choice. I believe it is moral, it is ethically good to go and earn your own way through this life. And so I applaud the people who are going back to work, even if it is less than what they were making on government unemployment benefits. The truth of it is, we're not paying for it right now with dollars. We pay for it because things cost more. I think that there's a lot of manufacturers out there who are paying extra overtime and paying out the nose for the people who are still working, because so many people don't go back to work. And so everything that requires a manufacturing process goes up in price because of that, right? And sometimes we can't get things. So the business that I help run here in town, we can't get parts and goods as easily as we could before. And that impacts us. We have to charge more of our customers. It's just stupid.
I think we see, I mean, we could go on and on with examples on anytime that there's more government regulation, it's going to impact businesses in a negative way, where they have to charge more. You have to, increase minimum wage means all these other things, right? We've talked about increasing minimum wage in a previous episode and things like that. So I think that the takeaway, the thing that we want people to open their eyes to, as it were, is that we are seeing government regulation left and right, right? It's happening.
Yep.
Whether we want it to or not, it's coming down the pipeline. It's already here in many cases. And we need people to recognize that there is a safe way to protect yourself, a guaranteed way to protect yourself and your finances from the oversight of, the
oversight. That's the nice way to call it.
Yeah, right. Oh man.
Keep it out of the hands of the greedy money grabbers.
Yeah.
That's what we're here for. And then if we have to pay for our own health care, or if we have to earn a little bit less by going to work than we had on unemployment, that can't last forever anyway. All of us know that. There's no free lunch forever, right? Keeping more of the money you make and keeping it safe. You and I have talked with a doctor in town, met with him a few times. He started this clinic that is membership based, right? My family and I are part of that. And we love being able to go to in fact, I do the same thing with my chiropractor. I pay a monthly membership. My wife and I go to the chiropractor as many times as we want during a month. I love that. We do the same thing with the doctor's office. And the less regulated these providers are, these are important services. And so the less regulated they are, the more likely they are to come up with creative solutions for problems, right?
Oh yeah.
And one of the reasons I enjoy working with business owners, and I think you would echo this sentiment, is that business owners are so creative. They have the courage to venture out and do something like raise cobras in order to make money. And so we work with business owners who find real solutions to real problems. And if we can help those people keep more of the money they make, they have more capital to put back into solutions that really work for people. I'm so glad that those two physicians had the capital necessary to create this clinic that personally works better for my family and I. It doesn't need to work better for everybody, but we need to have choices and options, right? And so for my family and I to have enough money to pay for those memberships, or to have enough money saved to pay for an emergency that might come down the line, that's my choice. And I want that choice. I want to have the opportunity, the ability to protect money, to save my own money, and to keep it for when I need it.
You know, there's a program that was coming down the pipeline. We'd talked about it. I showed you a video, way back when, a few months ago, about this program that was going to really help out with the healthcare industry,
Yes,
right?
yes.
It was a unique solution, and it wasn't anything new. They had just learned to combine a couple different products, programs in a way that would really help businesses provide a solid financial or a solid healthcare solution to the problems that the shortages that exist currently in healthcare. It was coming down the pipeline, and they had to hold back. They had to wait on the release, and they pushed it back multiple times. And the reason why they did was because of increased government regulation with all the new policies that Biden has put out there, right? I mean, they were ready to come out. And once they found that Biden was going back into the office, they said, oh man, this isn't going to work right now, because we know what happens when, to put it frankly, when Democrats are in office, right? We know that regulations, under Obama, these were the regulations. That's coming back, right? We know that that's coming back. So we can't financially make this work at this point. We've got to find a way. And so there was one point where the one regulation that was what was present during Obama that they basically spent a couple $1 million to figure out how to comply with this regulation while still being able to provide the program that would make be a way better financial situation, healthcare situation for all these employees. So anyway, we could go on and on. There's so many examples of how regulation affects
how expensive it is.
How expensive it makes things, and just capitalism. It's funny to me how these alt-left people are really going after capitalism right now, and how they're demonizing the word of capitalism, and just how capitalism has solved so many of the world's problems, and we are turning it into this big negative thing.
Yep.
So anyway, we're getting close to out of time. We are out of time right now.
Remind me of this. There's an example right here in Little Blackfoot, Idaho. A guy who came up with a solution to the fact that landfills are full of plastic, and it's incredible. He's one of my heroes. So we'll talk about that next time. Thanks for tuning in. Anything else you want to say?
I think that's good. I'll come up, maybe I'll share one of my other embarrassing moments next time.
We can only hope.
See. Yeah. So, all right. My name's Eric.
I'm Matt.
And Common Sense Conversations. Have a good day.